Okay. Good morning, everyone. I'm Tom Stolz. I'm Sedgwick County Manager, and I'm here this morning, March 20th, along with Chairman Pete Meitzner to give a daily update on the situation surrounding COVID-19. Starting, as we discussed yesterday, from a national working to state, working to local level. On a confirmed case update, there are currently today, as of today, 10,442 cases, confirmed cases of COVID in the United States, 37 in the state of Kansas. We had one in Sedgwick County reported yesterday, which the chairman will talk about in a little bit. We've had a number 2 cases confirmed in Butler County, which is a neighboring county. One other piece of national data that was picked up this morning, the CDC is beginning to compile more data as this situation advances. And a large percentage of hospitalizations currently happening in the United States impact the population aged 20 through mid-50s. So though we have talked about many times, and you've heard many times, that this infection targets seriously elderly and compromised, it is important to know that this is targeting all kinds of people. So it's serious. Things like cleanliness, hygiene, proper distancing are important for all populations in Sedgwick County now. Chairman?
Yes. Good morning, everybody. Last night, as Tom mentioned, it was announced that Sedgwick County, we have had our first presumptive positive case. The person is a female resident over the age of 60. She is currently in home isolation under the CDC guidelines and being closely monitored by our Sedgwick County Health Department. There is no known travel history associated with this case at this time. Our health department has contacted and monitored the residents and associates that may have come in contact with her. So there is active work on the contacts. We covered that last night in a press conference. And so for the rest of the public, that we do have our first case. We knew we were going to have a case, and we've had it, and we'll probably likely have more. So,
okay.
Back to Tom.
Just as a heads up, there's no changes that we know of in the state of Kansas, except that the Capitol has closed to public access. They're trying to do all business operations through electronic and telephone methodology. For those that just watched the special meeting of the county commission, the county has taken on a similar policy, which the chairman will come back and talk to in just a little bit. At a local level, we continue to get a lot of questions about testing. And as we have said before, what is happening now is commodity shortages along these lines. We're having, it's a challenge to get test medium. And there's 2 stages. Let's talk about testing for just a second. There's 2 stages. We have to get a sample from a patient, and then we have to send that sample to a lab. The lab of preference is KDHE, although we have 2 private labs on contract that can do thousands of tests a day. So getting the test results done is not the issue. It's the sample side of this, the beginning side, where we meet with a patient, swab them, put it into the proper medium, and ship it. We do not have enough of these sample kits today to create a more global testing system. So those samples that we have are priority. We try to keep them reserved for people that truly meet the criteria and who are compromised. And for our emergency workers who are out every day becoming exposed to this situation. So we are working through that. We have enough cases right now, enough sample kits right now to where if people feel they are suffering from the symptoms of COVID, we recommend that they call 211, which will they will ask them basic screening questions. If those screening questions meet the requirement, they will then be passed to a health department official who will also screen them to some degree. And if the health department official sees protocol in place, they will give you an appointment and designate you a location to go to within our health system to get a test. Or the other option is contact your private physician and seek guidance from them on what they suggest to do to move forward to potentially be tested. once the commodity shortage is solved, and let's talk about commodity shortages just for a bit. We are all trying to get basic things like rubber gloves and masks, hand sanitizer, those types of commodities to our healthcare and frontline providers. It's critical that we do that. We are having some success there. And when we get enough test kits, and I don't know what the magic number is, but several dozen test kits, we have the capacity, we have the strategy, and we already have the plan in place to prop open a central point testing facility, drive-through type of facility that we will open as soon as we get commodity. So we are working on that, and that is the plan as we move forward. Chairman, you want to talk about maybe this morning?
Yes, and this morning we had a special meeting on Friday, and we accepted and approved the plan that was presented to us, which was called a service delivery plan. Changes to it, as you all know, Sedgwick County is a service provider for our community, and in that, a couple of things that were important. We're going to implement the closing of some of non-essential facilities, encourage citizens to still set appointments by phone or get information and get your business done by phone. We'll have a lot of remote employees starting Monday, but the public needs to understand, I think we have 2,800 employees, and maybe half of them, there's emergency essential services, the jail, the sheriff's department, fire, EMS, some of those things, and then a few others that are essential for us. And so they will still be working under the plan that's presented from the manager this morning. And we're kind of doing this on the fly, so if you have any other thing to add
It's
to that.
important that, as I mentioned at the beginning, the state capitol has closed down to the public. They're still running services. We are following suit. We are still running services. Our offices are staffed here. We have a specific strategy on how we were staffing. We are following our health department's director's recommendation that we maintain proper spacing between workers. We are limiting public coming into this building. It's still possible by appointment, and when you come to the courthouse, expect to be stopped by the courthouse security. They will ask you basic questions about your health, which I think any public building now or any business in general will begin to do that. It's just prudent. And then you will be allowed into the building if you have an appointment to go to a certain function within the courthouse. But by and large, walk-in traffic will not be allowed any longer. And that is only at the courthouse. Other facilities, Reagan, for example, appointment only. You can still get into that building, have to call ahead. Somebody will let you in to take care of your business. Historic courthouse will be closed, and many other facilities will be totally closed. But still, staff on hand to answer phones, answer emails, take care of business as best we can in this time.
And I want to remind everybody that we've been advised by our communications department that they are updating our website at www.sedgwickcounty.org, and if you go to that, hopefully we have all the links of important federal, state, other services that you can click on and get real data, accurate data. I want to remind what Tom has said, that spacing is still very important, and I think everybody's understanding that. Seems like we have a fantastic community. He's been very respectful and cooperating on that. And to remind you that each of the commissioners are fully engaged in this. They each bring a connecting point to various areas that they had their own personal interest or their own personal relationships. We're on, seems like, hourly phone calls with key people within the state and within the service and even our federal level. And so this has been an evolving event that we are working really hard on, And I just encourage our citizens to keep practicing and try to live your life as normal as you can. And with that,
We'll be back Monday. A commissioner and a Sedgwick County staff member will be back at 11 o'clock Monday for a further update.
thank you.